"Sir, you need to leave this hospital now," Nurse Thompson said, her tone clipped and firm. The staff at St. Mary's Medical Center saw only a homeless man seeking shelter from the rain, not understanding that James McGrath was clutching his scarred left hand from something more serious than phantom pain. "I'm just a patient seeking medical care," McGrath said with quiet dignity. "Missing fingers can't hurt," Rodriguez snapped back as patients laughed. Security roughly escorted the old man toward the exit. Meanwhile, Dr. Chen burst into the operating room. "There's a homeless vet. His name is McGrath." That name struck the doctor like lightning. "I'm stopping this operation right now." The head surgeon ran downstairs and saw the weathered old man. What he did next changed the history of that hospital forever. James McGrath pushed through the glass doors of St. Mary's Medical Center with his left shoulder, keeping his left hand pressed tightly against his chest. October rain dripped from his worn khaki military jacket onto the polished hospital linoleum, each drop echoing in the bustling reception area like a quiet plea for attention. The 68-year-old man moved with the careful gait of someone carrying invisible burdens. His graying hair, dampened by the Chicago drizzle, clung to his weathered forehead. The faded patches on his jacket sleeve bore the barely visible insignia of the 82nd Airborne Division, their once proud colors now muted by decades of wear and countless washings at the downtown shelter. McGrath approached the registration desk, favoring his left leg slightly. His right arm revealed a faded tattoo of a medical caduceus, the serpent-wrapped staff partially obscured by the rolled sleeve of his patched denim shirt. The symbol seemed oddly out of place on a man who, to casual observers, appeared to be just another homeless individual seeking warmth from the October cold. "Excuse me," McGrath said softly to the receptionist, a young woman whose perfectly manicured nails clicked against her keyboard without pause. "I need to see someone about inflammation in an old injury site." The receptionist glanced up briefly, her expression shifting almost imperceptibly as she took in his appearance. The rain-soaked jacket, the worn boots with their carefully tied laces, the way he kept his left hand hidden in his pocket, all of it registered in her eyes before she responded. "Do you have insurance? Medical cards? Any form of identification?" she asked, her tone professionally distant. McGrath reached into his jacket with his right hand, producing a tattered military identification card. The plastic was clouded with age, the photograph showing a much younger man in crisp army dress uniform. "I have this, but no insurance currently. I live at the Veterans Haven shelter on the south side." The receptionist examined the card briefly before setting it aside. "Without insurance, we require a $300 deposit for emergency room services. Do you have a credit card or cash?" "I don't have that kind of money," McGrath replied, his voice steady despite the increasing pain that seemed to radiate from his hidden left hand. "But this is urgent. I believe there might be an infection, possibly developing into something more serious." The way he spoke, using precise medical terminology, his diction clear and educated, seemed to surprise the receptionist. She looked at him again, more carefully this time, as if trying to reconcile his appearance with his articulate speech. "I'll need you to wait over there," she said, pointing toward a section of plastic chairs near the far wall. "Someone will call you when we can determine if this is truly an emergency situation." McGrath nodded with quiet dignity and made his way to the designated waiting area. As he walked, other patients unconsciously shifted away, creating an invisible barrier around the space where he chose to sit. An elderly woman whispered something to her husband, who glanced over before deliberately turning his chair to face away. The waiting room's fluorescent lights cast harsh shadows across McGrath's weathered features. He sat straight back despite his obvious discomfort, his military bearings still evident after all these years. Every few minutes, he would subtly massage his left arm through the jacket pocket, his jaw tightening almost imperceptibly with each wave of pain. Hours passed with painful slowness. Other patients arrived after McGrath, well-dressed individuals with proper insurance cards and smartphones, and were processed quickly. A businessman with a minor cut on his hand was taken back within 20 minutes. A teenager with a sports injury disappeared behind the treatment doors after barely 15 minutes of waiting. Each time McGrath approached the desk to inquire about his status, he was told to return to his seat and wait. "We're very busy today." became the standard response, delivered with increasingly less patience each time he asked. Around him, conversations carried easily in the waiting room. A mother covering her young child's view whispered, "Don't stare at that man, sweetie." Two college students discussed their weekend plans while casting occasional glances in his direction, their expressions mixing curiosity with distaste. McGrath endured it all with remarkable composure. He didn't complain when a family took seats that had been empty beside him, only to move away after noticing his presence. He remained silent when someone made a comment about people who clearly aren't here for real medical needs. His only acknowledgement of the treatment was a slight straightening of his shoulders, a gesture that spoke of decades of military discipline. The afternoon wore on, and McGrath's condition worsened visibly. What had begun as manageable discomfort was evolving into something more concerning. Sweat beaded on his forehead despite the air conditioning, and his breathing became slightly more labored. It was then that senior nurse Sarah Thompson approached, her crisp white uniform bearing a small pin indicating 8 years of service. Behind her walked Jessica Rodriguez, a younger nurse whose expression suggested she was eager to demonstrate her professionalism to her supervisor. "Sir," Thompson said, her voice carrying the authority of someone accustomed to maintaining order, "I understand you've been waiting here for several hours. What exactly is the nature of your complaint?" McGrath looked up, meeting her gaze directly. "I'm experiencing what I initially thought were phantom pains in my left hand, but the symptoms are suggesting possible inflammation of the residual limb. There's increasing warmth, throbbing, and I'm concerned about potential infection." Rodriguez exchanged a look with Thompson. "Phantom pains," she said, barely concealing a smirk. "From phantom fingers." With careful deliberation, McGrath withdrew his left hand from his pocket. Where his index, middle, and ring fingers should have been, only carefully healed surgical stumps remained. The scars were old but precise, clearly the work of a skilled surgeon rather than a traumatic accident. "The nerves were severed cleanly," McGrath explained patiently, "but nerve endings can still transmit pain signals. However, what I'm experiencing now feels different. The inflammation seems localized to this area." He indicated a spot on the side of his hand with clinical precision. Thompson's expression hardened. "Sir, if the fingers aren't there, then logically there can't be any real pain. We deal with actual medical emergencies here." "But I can explain the neurophysiology," McGrath began. "Listen," Rodriguez interrupted, her voice growing louder and attracting attention from nearby patients. "We don't have time for made-up medical conditions. There are people here with real problems." McGrath's composure never wavered, though something flickered in his eyes. Not anger, but a deep, weary sadness. "I understand your skepticism," he said quietly. "I know how this must appear." Other patients were beginning to take notice of the conversation. A few pulled out their phones, seemingly ready to record what they apparently perceived as entertainment. Someone snickered at the back of the waiting room. "Look," Thompson said, her patience clearly exhausted, "I think it would be best if you sought help elsewhere. This facility serves patients with genuine medical needs." At that moment, an elderly woman in the corner began choking on something, her hands flying to her throat as she made desperate gasping sounds. Panic rippled through the waiting room as people stood up, unsure of what to do. Without hesitation, McGrath rose from his chair. "Lift her chin up. Open the airway passage," he called out with calm authority, his voice cutting through the chaos with practiced precision. The woman's daughter followed his instructions exactly, tilting her mother's head back and opening her mouth. Almost immediately, the older woman began breathing again, the obstruction dislodged by the simple but crucial repositioning. For a moment, the waiting room fell silent. McGrath's knowledge, the certainty in his voice, the way he had known exactly what needed to be done, it was the behavior of someone with extensive medical training, not a homeless man seeking attention. Dr. Emily Chen, a young neurological resident who had been passing through the waiting area, stopped and stared. She had witnessed the entire exchange, noting not just McGrath's medical knowledge, but the professional way he had assessed and responded to the emergency. But the moment of recognition was brief. Thompson, seemingly embarrassed by the incident, became more aggressive in her approach. "That was just common sense," she declared loudly. "Anyone could have said that," Rodriguez nodded in agreement. "Exactly. Stop trying to impress people with basic first aid. The other patients, who moments before had been genuinely grateful for McGrath's intervention, seemed to accept this explanation readily. The phones came back out, and the whispered conversations resumed. McGrath slowly returned to his seat, his face showing the strain of maintaining dignity in the face of such systematic dismissal. The pain in his left hand was clearly worsening, but he made no further complaints. "Sir," Thompson announced in a voice loud enough for the entire waiting room to hear, "I'm going to have to ask you to show everyone these painful fingers of yours. Prove to all these people that you have a real medical condition." The cruelty of the request hung in the air like a challenge. Every eye in the waiting room turned toward McGrath, waiting to see how he would respond to this public humiliation. McGrath stood slowly, his military bearing intact despite everything. With quiet dignity, he extended his left hand for all to see. The missing fingers, the surgical scars, the evidence of a sacrifice made long ago in service to his country. But instead of sympathy, the display was met with scattered laughter and pointing. Someone in the back called out, "If there's nothing there, how can it hurt?" As McGrath stood there, his scarred hand exposed to the mockery of strangers, the full weight of his invisible burden became clear. This was a man who had given pieces of himself in service to others, only to find himself dismissed and ridiculed when he needed help the most. The afternoon rain continued to beat against the hospital windows, each drop seeming to echo the steady erosion of one man's dignity in a place that had sworn to, first, do no harm. The scattered laughter echoing through St. Mary's waiting room seemed to hang in the air like smoke, thick and suffocating. James McGrath slowly lowered his scarred left hand, his movements deliberate and controlled, despite the visible tremor of pain that ran through his arm. The fluorescent lights overhead cast harsh shadows across the surgical stumps where his fingers once were, making the old scars appear more pronounced. Dr. Emily Chen stood frozen near the corridor entrance, her medical bag clutched tightly in her hands. As a neurological resident, she had studied phantom limb syndrome extensively, and everything about McGrath's demeanor suggested genuine medical distress. The way he held his arm, the subtle signs of autonomic response she could observe from across the room. These were not the behaviors of someone seeking attention or sympathy. "Well?" Nurse Thompson's voice cut through the murmurs of the waiting room like a blade. "Are you satisfied now? We've all seen your hand. There's nothing there to treat." McGrath settled back into his plastic chair with the careful precision of someone managing chronic pain. "I understand your position," he said quietly, his voice carrying that same educated cadence that seemed so incongruous with his appearance. "I appreciate your time." The response clearly frustrated Thompson, who had apparently expected either anger or surrender. Instead, McGrath's persistent dignity seemed to fuel her irritation. "This is exactly the problem," she announced to Rodriguez, though her voice carried far enough for others to hear. "People come in here expecting free medical care for imaginary conditions." Rodriguez nodded eagerly, pleased to have her supervisor's approval. "Exactly. If we treated everyone who claimed to have problems we couldn't see, we'd never have time for real patients." Several people in the waiting room had their phones out now, some openly recording the interaction. A teenager near the magazine rack was live streaming, providing commentary for her followers about the crazy homeless guy claiming phantom pain. An older businessman typed rapidly on his phone, presumably sharing the story on social media. McGrath seemed aware of the cameras but showed no reaction beyond a slight straightening of his already perfect posture. There was something almost military in the way he held himself, spine straight, shoulders squared, eyes forward, as if he were standing at attention rather than sitting in a hospital waiting room. Dr. Chen found herself moving closer, drawn by a combination of professional curiosity and growing concern. She had noticed how McGrath's breathing pattern suggested someone managing significant pain, and the medical precision of his earlier intervention with the choking woman had been remarkable. Most importantly, she had observed the subtle but unmistakable signs of autonomic nervous system activation that accompanied genuine phantom limb episodes. "Ma'am," McGrath addressed Thompson with unfailing politeness, "would it be possible to simply receive a referral to a neurologist? I don't require immediate treatment, just a consultation about pain management options." Thompson's expression hardened further. Sir, we don't provide referrals for conditions that don't exist. I'm going to have to ask you to leave the premises now. I'm not ready to leave yet, McGrath replied calmly. I'm still a patient seeking medical care. It was then that Thompson decided to escalate the situation. She walked briskly to the reception desk and picked up the phone, speaking in tones clearly intended to be overheard. Security to the main waiting area, please. We have an uncooperative individual who needs to be escorted out. The waiting room's atmosphere shifted perceptibly. Some patients moved their chairs farther away, while others leaned in with obvious anticipation. The teenager with the phone adjusted her position to get a better angle for her recording. Tom Harris, the head of hospital security, appeared within minutes. At 45, he carried himself with the aggressive confidence of someone who enjoyed exercising authority. His uniform was immaculate, his badge polished, and his expression suggested this was the most interesting thing that had happened to him all week. What seems to be the problem here? Harris asked, though his tone indicated he had already decided who the problem was. This gentleman is refusing to leave after being informed we cannot treat his condition, Thompson explained. He's been disruptive and is making other patients uncomfortable. Harris looked McGrath up and down, taking in the worn clothing, the military jacket, and the way he kept his left hand partially concealed. Sir, I'm going to need you to come with me. I haven't been disruptive, McGrath said evenly, remaining seated. I'm a patient waiting for medical care. I have every right to be here. Not when you're bothering other people and making false medical claims, Harris replied, stepping closer. Now we can do this the easy way or the hard way. For just a moment, something flickered in McGrath's eyes. Not fear, but the kind of quick tactical assessment that comes from years of training. His posture shifted almost imperceptibly, muscle memory from decades past causing him to automatically evaluate exits, positions, and potential threats. It lasted only a second, but Dr. Chen caught it, and her medical training helped her recognize what she was seeing. This was not the behavior of a typical homeless individual. This was someone with combat experience, someone whose body still remembered how to respond to confrontation even after all these years. There won't be any trouble, McGrath said, though he made no move to stand. I'm simply waiting to speak with a doctor about a medical condition. Harris's patience was clearly wearing thin. Look, buddy, I don't know what kind of game you're playing, but this isn't the place for it. These people have real problems, real injuries. They don't need to watch some street person putting on a show. The words hit their intended target. McGrath's jaw tightened slightly, and for the first time since arriving, his composure showed a hairline crack. But instead of anger, what emerged was something deeper, a profound sadness that seemed to encompass more than just the current situation. Dr. Chen found herself stepping forward. Excuse me, she said, addressing Harris but keeping her eyes on McGrath. I'm Dr. Chen, neurology resident. I've been observing this situation, and I believe this gentleman may have a legitimate medical concern. Harris turned to her with obvious irritation. Doctor, with all due respect, this guy's been here for hours claiming his missing fingers hurt. He clearly wants to hide here from the rain and is distracting the staff from their work. Actually, Chen replied carefully, phantom limb pain is a well-documented neurological condition. The symptoms he's describing are consistent with what I've observed clinically. Thompson stepped in quickly. Dr. Chen, I appreciate your concern, but we've already determined this isn't a case requiring medical intervention. McGrath looked up at Dr. Chen with something approaching gratitude. Thank you for listening, he said simply. Not many people understand the condition. Where did you learn about phantom limb syndrome? Chen asked, her medical curiosity overriding the social awkwardness of the situation. For a moment, McGrath hesitated, as if deciding how much to reveal. Personal experience, he said finally, and some medical training many years ago. Chen's eyebrows rose slightly. Medical training? Before McGrath could respond, Harris had heard enough. Okay, that's it. I don't care what kind of training he claims to have. He's using this to disrupting hospital operations and needs to leave now. Harris reached for McGrath's arm, intending to help him to his feet whether he wanted assistance or not. But the moment his hand made contact with McGrath's shoulder, something remarkable happened. McGrath's entire body went rigid. not with fear, but with a kind of controlled readiness that spoke of extensive training. His right hand moved instinctively to a position that would have been defensive, and his eyes swept the room with the kind of quick, comprehensive assessment that marks someone with combat experience. The reaction lasted only a split second before McGrath consciously suppressed it, but Dr. Chen had seen enough. This was not the response of an ordinary civilian, homeless or otherwise. This was muscle memory from someone with serious military training. "Please don't touch me without permission," McGrath said quietly, his voice steady but carrying an undertone of authority that made Harris unconsciously step back. A flashback hit McGrath like a physical blow. Suddenly, he was 26 years old again, crouched in a field hospital tent outside Da Nang. Young soldiers on gurneys, some missing limbs, others fighting for every breath. The constant sound of helicopters overhead, bringing in more wounded. His hands, whole then, all 10 fingers intact, working frantically to save a young medic who had taken shrapnel to the abdomen. The medic's face was so young, maybe 23, with a small birthmark on his neck. The kid kept trying to talk, to tell McGrath his name, but McGrath was focused entirely on the surgery, on stopping the bleeding, on keeping those young lungs working. "Stay with me, soldier," he had whispered then, just as he whispered now, unconsciously, in the hospital waiting room. The words hung in the air, and Dr. Chen felt the pieces of a puzzle beginning to shift into place. The medical knowledge, the bearing, the way he handled crisis situations, the precise surgical scars on his hand. This was not just any veteran. This was someone with significant medical training and combat experience. "What did you say?" she asked softly. McGrath looked up, realizing he had spoken aloud. For a moment, his careful composure cracked entirely, and she could see not just the pain he was managing, but the weight of memories that went far beyond his current physical discomfort. "Nothing," he said quietly. "Just remembering." Dr. Chen felt a growing certainty that there was much more to this story than anyone realized. But before she could ask another question, Harris was speaking again, louder now and with growing authority. "That's enough," the security chief announced. "Sir, you need to come with me right now, or I'm calling the police to have you removed for trespassing." The waiting room had gone completely silent. Every phone was now pointed in their direction, recording what everyone assumed would be the final humiliation of a homeless man who had overplayed his hand. McGrath slowly got to his feet, pain obvious in every movement. As he stood, his military bearing became even more pronounced, and Dr. Chen noticed something else: the way other people in the room unconsciously straightened up in response to his posture. "What's your name?" she asked suddenly, her voice cutting through the tension. McGrath looked at her for a long moment, as if weighing whether to answer. Finally, he spoke. "James McGrath," he said simply, "formerly of the 82nd Airborne Division." Dr. Chen felt her breath catch. Something about that name, that unit, stirred a memory she couldn't quite place. But before she could pursue the thought further, Harris was moving to escort McGrath toward the exit, and the crowd was pressing closer with their cameras, eager to capture the final moments of what they saw as an entertaining drama. None of them realized they were about to witness something far more significant than the removal of an unwanted patient. They were about to see the moment when a forgotten hero's true identity would finally come to light. Dr. Emily Chen stared at James McGrath as the name echoed in her mind. Something about the combination, James McGrath, 80th Airborne, the missing fingers, the medical knowledge, triggered a memory that made her heart race. She had heard this name before, but where? As Security Chief Harris moved to escort McGrath toward the exit, Chen suddenly remembered. During her medical residency orientation, Dr. Stone had told them about legendary military surgeon. That story in particular had stuck with her. About a young Army doctor who had saved countless lives in Vietnam, including performing an 8-hour surgery on a critically wounded medic while under enemy fire. The surgeon had lost 3 fingers halfway through the operation but continued working with one hand to save the young soldier's life. The surgeon's name had been James McGrath. "Wait!" Dr. Chen called out, her voice cutting through the murmur of the waiting room. "Mr. McGrath, did you serve as a military surgeon in Vietnam?" McGrath paused, Harris's hand still on his shoulder. For a moment, something shifted in his weathered features. Surprise, perhaps even hope. I was a field surgeon, yes, but that was a long time ago. Chen felt her medical training take over as pieces clicked into place. The operation outside Da Nang in 1971. You saved a young medic who had severe internal injuries. You lost your fingers during the surgery, but continued operating. The waiting room had gone completely silent. Even the teenagers with their phones seemed to sense that something significant was happening, though they couldn't yet understand what. McGrath's composure, which had held steady through hours of humiliation, finally began to crack. How could you possibly know about that? Because, Dr. Chen said softly, that story our chief surgeon repeated 100 times. Your doctor, James McGrath. You're a legend. Before McGrath could respond, she was already moving toward the corridor that led to the surgical wing. I need to get Dr. Stone, she called over her shoulder. He needs to hear this. Dr. Richard Stone was just beginning a routine appendectomy when his pager buzzed with an urgent message from Dr. Chen. Normally, he would have ignored any non-emergency interruption during surgery, but something about the message made him pause. Dr. Stone, please come to the waiting room immediately. James McGrath is here. The James McGrath. Stone's hands froze above his patient. James McGrath. The name hit him like a physical blow, carrying with it memories he had buried for over 50 years. Suddenly, he was 23 years old again, lying on a field hospital gurney with shrapnel in his abdomen, watching a young army surgeon work frantically to save his life. He remembered the explosion that had taken the surgeon's fingers. He remembered how the doctor had looked at his mangled hand for just a moment before continuing the operation, using surgical techniques Stone had never seen before or since. Most of all, he remembered the surgeon's face. Young, determined, completely focused on saving a life even as his own career was ending. That surgeon had been Dr. James McGrath, and Richard Stone owed him everything. Dr. Martinez, take over here, Stone commanded, stepping back from the operating table. This is urgent. Stone practically ran through the hospital corridors, his surgical scrubs still on, his mind reeling with the impossibility of what Chen had told him. McGrath had disappeared after the war. Stone had spent years trying to find him, to thank him, to tell him what his sacrifice had meant. But the man had vanished without a trace. When Stone burst into the waiting room, he saw the scene immediately. A weathered man in worn military clothing, being escorted by security while a crowd watched with their phones. But Stone's trained eye went directly to the man's left hand, to the precise surgical scars he remembered from 52 years ago. Stop, Stone said, his voice carrying the authority of someone accustomed to making life and death decisions. Let him go. Harris looked confused. Doctor, Stone, this man has been causing problems all afternoon. He claims to have phantom pain in fingers that don't exist. Stone walked directly to McGrath, studying his face carefully. Age had changed him, of course, but the eyes were the same, intelligent, compassionate, tired but unbroken. Show me your hand, Stone said gently. McGrath, confused by this turn of events, extended his left hand. Stone examined the scars with the practiced eye of a surgeon, noting the precise way the amputations had been performed, the careful attention to nerve endings that would minimize phantom pain. My God, Stone whispered, it really is you. He looked up at McGrath's puzzled face and said, Da Nang, March 15th, 1971. Operation Lifeline. You spent 8 hours saving the life of a medic named Richie Stone. McGrath's eyes widened with recognition and disbelief. Richie? Little Richie Stone? You've grown up, McGrath said softly, tears beginning to form in his eyes. Stone turned to address the waiting room, his voice carrying to every corner. Ladies and gentlemen, you are in the presence of one of the greatest heroes this country has ever produced. Dr. James McGrath saved my life in Vietnam. He lost his fingers, continuing my surgery under enemy fire, sacrificing his own career to ensure that a young medic would live to see another day. The transformation in the waiting room was immediate and profound. Phones that had been recording for entertainment were slowly lowered. The teenager who had been live streaming looked stricken with shame. The businessman who had been sharing jokes about the crazy homeless guy stared at McGrath with growing comprehension. Nurse Thompson's face had gone completely pale. Dr. McGrath, she whispered, I had no idea. I'm so sorry. McGrath, overwhelmed by the sudden recognition after decades of invisibility, simply nodded. It's all right, he said quietly. You couldn't have known. But Stone wasn't finished. Dr. McGrath didn't just save my life, he continued, addressing the room. He went on to save hundreds of others. He revolutionized field surgery techniques that are still used today. He earned the Silver Star for valor under fire. And because of his sacrifice, I was able to become a surgeon myself and save thousands of lives over the past 50 years. Stone reached into his pocket and pulled out his wallet, withdrawing a faded photograph. It showed two young men in military uniforms, one with his arm around the other, both smiling at the camera. I've carried this picture for 52 years, he said, hoping someday I'd find the man who saved my life. McGrath looked at the photograph and smiled through his tears. I remember that day, right before you shipped home. And now, Stone said, his voice taking on the authority of chief of surgery, we're going to properly address your medical condition. Harris, please escort Dr. McGrath to VIP Suite 12. Thompson, arrange for our best neurological specialists to consult on his case immediately. But Dr. Stone, Thompson began, his insurance will not be an issue, Stone cut her off firmly. Dr. McGrath will receive the finest care this hospital can provide, and it will be our honor to provide it free of charge. Stone then turned to examine McGrath's hand himself. You're right about the infection, he said after a careful assessment. There appears to be a fragment that's shifted and is causing inflammation. We'll need to perform surgery to remove it. I can't ask you to do that, McGrath protested. You're not asking, Stone replied with a smile. I'm insisting. It's the least I can do for the man who gave me my life. As McGrath was gently escorted to the VIP wing, the waiting room remained silent. People looked at their phones with shame, realizing they had been recording the humiliation of a genuine American hero. Several began deleting their videos without being asked. Dr. Chen approached nurses Thompson and Rodriguez. I think this situation calls for some reflection, she said gently. Perhaps we could all benefit from training on how to better serve our veteran community. Thompson nodded vigorously. Absolutely. I'll speak with administration about implementing new protocols immediately. The successful surgery to remove the infected fragment took place that same evening, with Dr. Stone personally overseeing the procedure. McGrath's recovery was swift, aided by the best care the hospital could provide. But the story's impact extended far beyond one man's medical treatment. Within days, the hospital announced a new program providing free medical care for homeless veterans. Nurse Thompson volunteered to spearhead the initiative, dedicating herself to ensuring no veteran would ever again face the kind of treatment McGrath had experienced. McGrath, once recovered, was invited to speak at medical schools across the country, shares how he performed a heroic act by sacrificing everything for the sake of a patient's life. His talks drew standing ovations and helped train a new generation of physicians to recognize that heroes often walk among us in the most unexpected forms. The waiting room at St. Mary's Medical Center now features a plaque that reads, "In honor of all veterans who have served our country with distinction, we pledge to treat every person who enters these doors with the dignity and respect they deserve." And in Dr. Stone's office hangs a new photograph. Two old friends reunited after more than half a century, their bond forged in the crucible of war and strengthened by the enduring power of gratitude and recognition. McGrath's story serves as a powerful reminder that true heroism doesn't fade with time or circumstance. It lives on in the hearts of those who serve, waiting patiently for the moment when society remembers to honor the sacrifices made by those who gave so much for others. The greatest honor we can give our veterans is not just our thanks, but our recognition that their service continues long after their uniforms are put away, and that every person deserves to be treated with dignity, regardless of their appearance or circumstances.